Project E3 Educate, Empower, and Employ Fall 2016 Vocational Rehabilitation Technical Assistance Center Targeted Communities VR-TAC-TC. Welcome to the Vocational Rehabilitation Technical Assistance Center for Targeted Communities, or VR-TAC-TC. We call ourselves Project E3 and provide technical assistance to state VR agencies so they can better educate, empower, and employ individuals with disabilities within targeted communities. The Vocational Rehabilitation Technical Assistance Center Targeted Communities VR-TAC-TC is established under a grant from the Department of Education, Rehabilitation Services Administration, RSA, Award CFDA 84264F. The opinions expressed in this presentation are those of VR-TAC-TC, not of RSA. Project E3 was developed with support and input from Louisiana Rehabilitation Services, LRS, and is a strategic partnership of Southern University in Baton Rouge, a historically black college and university. 6 other institutions of higher education are included in the partnership: the University of Wisconsin-Madison, University of Wisconsin-Stout, George Washington University in Washington, D.C., the University of Illinois at Urbana-Champaign, the University of Kentucky in Lexington, and Virginia Commonwealth University. The Council of State Administrators of Vocational Rehabilitation, or CSAVR, and Employment Resources, Inc. are also partners, along with a network of expert consultants. The contents of this presentation were developed with support from the Vocational Rehabilitation Technical Assistance Center for Targeted Communities, VR-TAC-TC Project E3, at the Department of Rehabilitation and Disability Studies, Southern University, Baton Rouge, LA, funded by the U.S. Department of Education, Rehabilitation Services Administration, grant number H264F15003. The ideas, opinions, and conclusions expressed, however, are those of the presenters and do not represent recommendations, endorsements, or policies of the U.S. Department of Education. The driving issue for Project E3 is that vocational rehabilitation alone has not been able to address the persistent, pervasive, and multi-layered needs of the economically disadvantaged targeted communities that are high-leverage groups with national applicability. Ensuring employment opportunities for people with disabilities is important not just for those individuals, but also for employers, government, and society. The purpose of Project E3 is to provide technical assistance, TA, to state VR agencies and their partners to address barriers to VR participation and competitive integrated employment of historically underserved groups of individuals with disabilities. Intensive TA will be provided on-site through long-term service delivery relationships with local VR agency personnel and community-based partners in economically disadvantaged communities identified by the VR agencies themselves. Targeted and universal TA will also be provided. Targeted communities are defined as any economically disadvantaged community that qualifies as an empowerment zone. In order for a community to qualify as an empowerment zone, the median household income is under 200% of the federal poverty level. The unemployment rate is at or above the national average. As a group, individuals with disabilities have historically sought, have been eligible for, or have received vocational rehabilitation (VR) services, or have achieved competitive integrated employment at 65% or less of the state VR agency's employment outcome level. What is a high-leverage group with national applicability? A high-leverage group with national applicability is a group of individuals with disabilities who are frequently identified by state VR agencies as being either underserved or as achieving substandard performance. Examples of high-leverage groups include residents of rural and remote communities, educated adults and youth, individuals with disabilities in foster care, individuals with disabilities receiving federal financial assistance, culturally diverse populations, high school dropouts and functionally illiterate consumers, persons with multiple disabilities, SSI and SSDI recipients, including sub-minimum wage employees. National applicability indicates presence of group needs in multiple locations across the nation, frequently identified by state VR agencies in statewide comprehensive needs assessments as either underserved or who have achieved substandard performance. Underserved individuals means individuals with disabilities who, because of disability and other variables, have historically sought, been determined eligible for, or received VR services at a rate of 65% or more of the state's overall service level groups, and include, but are not limited to, those persons identified in the listing of high leverage groups. Project E3's desired outcomes for individuals with disabilities in low-income communities are to increase their participation in state VR programs, increase the number and percentage served through the state VR programs who complete their VR program and enter into competitive integrated employment, increase the amount of support services provided through community agencies and support systems to those who are participating in a VR program, and Project E3 activities will develop collaborative, coordinated service strategies among state VR programs and community support services, agencies, and systems to provide more comprehensive services to those who are engaged in a VR program. Project E3 has 4 primary objectives for state VR agencies. They are: first, to involve state VR agencies in the development of knowledge and identification of targeted communities. Second, to collaboratively design modules and strategies for provision of intensive, targeted, and universal technical assistance and coordination activities to VR stakeholders that serve economically disadvantaged persons with disabilities and high-leverage groups with national applicability. Modules and strategies will be provided via field-based and in-office technical assistance, a state-of-the-art website, and 2 communities of practice. Third, to provide technical assistance to state VR agencies, their partners, employers, and community leaders that is designed to maximize community support services in targeted communities. And fourth, to measure and track the effectiveness of ongoing technical assistance, training, and alliance building activities. Project E3 can benefit state VR agencies by increasing their capacity to identify, engage, and expand services for VR-eligible economically disadvantaged individuals who could benefit from VR services, establish or expand upon partnerships with local social service and community development agencies, correctional facilities, community rehabilitation programs, CRPs, school systems, employers, community leaders, and other relevant stakeholders, and implement comprehensive support services to increase VR participation rates of individuals and high-leverage groups with national applicability by addressing systematic barriers such as poverty, homelessness, food insecurity, safety concerns, interpersonal and family issues, language barriers, lack of transportation, and childcare. Many agencies wonder what they'll need to contribute in terms of time, staff, and resources in order to participate in Project E3. Project E3 partners will assume most of the responsibility of the intensive TA proposal development and implementation work. The VR agency role will consist primarily of identifying priority underserved communities and populations, providing VR data regarding those communities and populations, describing pertinent barriers, challenges and opportunities, facilitating E3 follow-up with SRC, SILC, VR staff and state and local stakeholders, and making VR staff and partners available for future TA and training. The following slides will give you some background information to help you understand the need for Project E3. This map shows how census information is based on regions and divisions of the United States. The U.S. is divided into the Western region, which includes the Pacific West and Mountain West regions, the Midwest region, including the West North Central and East North Central regions, the Northeast, including the Middle Atlantic and New England regions, and the South, including West South Central, East South Central, and South Atlantic regions. In 2014, 58,214,000 individuals, or 18.7% of the U.S. population of 314 million, were persons with disabilities. 33.9% of the population between the ages of 18 and 64 with disabilities were employed, and 74.2% for people without disabilities were employed. 28.7% of persons with disabilities of working age were living in poverty, and 13.6% persons without disabilities were living in poverty. This information is based on research done by Stoddard S. in 2014 and reported in the 2014 Disability Statistics Annual Report. This map shows that in 2013, the states with 9.5 to 11.2% of civilians with disabilities living in the community were California, Utah, Colorado, Nebraska, North Dakota, Minnesota, Illinois, New York, Connecticut, New Jersey, Maryland, and Alaska. States with 11.2 to 12.7% were Arizona, Wyoming, Texas, Kansas, Iowa, Wisconsin, New Hampshire, Massachusetts, Rhode Island, Virginia, Georgia, and Hawaii. States with 12.7 to 14.4% were Washington, Idaho, Montana, Nevada, South Dakota, Missouri, Michigan, Indiana, Ohio, Pennsylvania, Vermont, North Carolina, and Florida. States with 14.5 to 20.2% were Oregon, New Mexico, Oklahoma, Arkansas, Louisiana, Mississippi, Alabama, Tennessee, Kentucky, West Virginia, South Carolina, and Maine. This map shows that in 2013, the states with a 25.4 to 31.5% employment rate of civilians with disabilities were Michigan, Maine, Kentucky, West Virginia, Arkansas, Louisiana, Tennessee, Mississippi, Alabama, Georgia, South Carolina, North Carolina, and Florida. States with a 31.5 to 35.35% employment rate of civilians with disabilities were Oregon, California, Arizona, New Mexico, Missouri, Indiana, Ohio, Pennsylvania, New York, Vermont, and Massachusetts. States with a 35.3 to 40% employment rate of civilians with disabilities were Washington, Idaho, Montana, Nevada, Oklahoma, Texas, Illinois, Rhode Island, New Jersey, Delaware, Maryland, Virginia, and Hawaii. States with a 40.1 to 52.8% employment rate of civilians with disabilities were North Dakota, South Dakota, Minnesota, Wisconsin, Iowa, Wyoming, Utah, Colorado, Nebraska, Kansas, New Hampshire, and Alaska. Research has shown that workers with higher education have improved employment outcomes. Workers with disabilities earn less than their peers. For every dollar paid to workers without disabilities, those with disabilities receive only 63% on average. This is 37% less pay for those with disabilities. The source of this information is An Uneven Playing Field, the Lack of Equal Pay for People with Disabilities, published in 2014 by the American Institutes for Research, AIR. The pay gap widens as educational attainment increases. When looking at earnings by the highest levels of education completed, we see that for workers with high school diploma or equal, no college degree, those without disabilities earn an average of $29,471, and those with disabilities earn $22,966. Workers with an associate's degree without disabilities earn an average of $39,968, and workers with disabilities earn $32,768. Those with a bachelor's degree without disabilities earn an average of $56,822, and those with disabilities earn $46,103. Workers with a master's degree or higher without disabilities earn an average of $87,771, and workers with disabilities earn $66,899. The source of this information is an uneven playing field, the lack of equal pay for people with disabilities, published in 2014 by the American Institutes for Research, AIR. The employment of persons with disabilities makes our society stronger. According to the AIR 2014, broader economic impacts found that lack of equal pay cost the U.S. economy $141 billion, amounting to about 1% of gross domestic product, or about as much as the federal government allocates to education. Loss of tax revenue is another consequence, totaling more than $25 billion for the federal government and more than $6.5 billion for the states. There is a widening gap between those with work-limiting disabilities and those without when it comes to household income, employment, and poverty. According to the Employment and Disability Institute at Cornell University, between 1990 and 2013, the median household income for all adults 21 to 64 years old increased from $62,800 to $63,900. And the median household incomes for those without a work limitation fell from $60,000 to $58,400. During that same period, the median household income for those with a work limitation fell from $36,400 to $30,600. The same study showed the employment rate for all adults 21 to 64 years old fell from 78.4% to 76.5% during that period, and the employment rate for those without a work limitation fell from 74.7% to 71.2%. The employment rate for those with a work limitation fell from 28.4% to 14.4%. The poverty rate, the share of people and families with incomes below the poverty line, for all adults 21 to 64 years old rose from 27.5 to 32.1% between 1990 and 2013. In that same period, the poverty rate for those without a work limitation rose from 10.2 to 13%, and those with the work limitation rose from 8.8 to 11.1%. These numbers are based on median household income and are adjusted for inflation to 2013 dollars. For people with disabilities, employment has not just economic value, but important social and psychological value as well. Although the United States provides vast opportunities for success in career and work pursuits, these opportunities are not and have not been equally accessible to all people, according to Bluestein, 2006, Bluestein, McWhirter, and Perry, 2005, Fawad, 2006, and Metz and Gaychard, 2009. Even when those who have been afforded less societal and cultural privilege are able to access such opportunities, their success and achievements may not be recognized in an equitable manner, as shown in research by Badgett et al., 2007, Combs and King, 2005, Fawad et al., 2008, and Jutunen et al., 2001. As noted in the Joint Needs Assessment sponsored by RSA 2016, VR agencies were asked to consider the geographic areas of their state that have high poverty and unemployment above the national average and to rate need for technical assistance to better serve specific groups of persons with disabilities living in those areas. These were the top 5 highest ranked populations identified by VRs for needed technical assistance. Percent of need for technical assistance for the following populations of people with disabilities as determined by VR agencies: autism 81%, schizophrenia and other psychotic disorders at 67%, traumatic brain injury at 61%, personality disorders at 60%, post-traumatic stress syndrome at 56%. The top 5 concerns which limit service provision or economic opportunities for people with disabilities living in high poverty and high unemployment geographic areas were reported as being: lack of affordable, reliable, safe transportation options at 86%, lack of high-quality jobs in the area at 65%, pervasive poverty stressors, such as food insecurity, secondary health problems, safety concerns, etc., experienced for more than one generation at 57%, lack of self-employment opportunities at 47%, lack of other employer networks in these areas at 42%. The following slides provide information about targeted community populations with which Project E3 is concerned. A population of focus for Project E3 is high school dropouts and transition-aged youth. There are approximately 60 million transition-aged youth in the U.S., including minorities and non-minorities. This is about 20% of the country's population and is one of the most ethnically diverse and fastest-growing groups. It also has a workforce participation rate lower than the general population, according to research published by Bloom and Qureshi in 2011. In 2010, transition-aged youth between the ages of 16 and 19 years old without a disability had a 21.6% unemployment rate, while youth with a disability had a 33.4% unemployment rate. Transition-aged youth between the ages of 20 and 24 years old without a disability had a 12.9% unemployment rate, while youth with a disability had a 22.2% unemployment rate. According to Fogg and Harrington, in 2010, teens with disabilities were 1.2 to 1.5 times more likely to be unemployed than those without disabilities. In most cases, youth with disabilities and minorities have the same aspirations and dreams as those without disabilities, according to research published by Burchard in 2004. However, Stewart et al. Found in 2010 that considerable gaps exist between the aspirations of youth with disabilities and their outcomes. Youth with disabilities from ethnically diverse backgrounds face a series of challenges, including a culture that stigmatizes them for being different while overlooking their strengths and lowered self-esteem coupled with limited peer acceptance, according to findings from Fitzgibbon, Cook, and Falcon in 2000. Transition-age African American youth with disabilities from low-income families are less likely to complete high school than those from high-income families. 2 years after high school graduation, transition-aged African American youth are less likely to secure employment than Caucasian American youth. Those with emotional, intellectual, and behavioral disabilities are worse off than any other group, according to research published by Wagner, Newman, Cometto, Garza, and Levine in 2005, and by Wills in 2008. This research suggests that disability is an added hindrance to securing employment, and being part of a high-leverage, culturally diverse group complicates the issues of career development even further. In addition, new research to identify predictors of employment for young African American men recovering from substance use disorders was recently published by Pete, Diala, Kaya, Brooks, Allen, Beziak, and Chan, 2016, in Vocational Rehabilitation as a Public Health Intervention for Young African American Men with Substance Use Disorders. Results indicated employment is an important public health intervention for people in poverty, including a large portion of people with disabilities. Although state VR agencies can be a critical resource for addressing the disproportionate unemployment rates for young African American men recovering from substance use disorders, state VR services are significantly underutilized by this highly stigmatized group of individuals. The current study demonstrated VR services can be used to improve the likelihood of successful employment outcomes for young African American men with substance use disorders. In addition, VR services that are particularly effective and services that are ineffective were identified for this population. Overall, the number and type of VR services had more influence on competitive employment than did demographic variables or Social Security disability benefits. These research findings support the intent and actions of the E3 project. Project E3 activities will include knowledge development, targeted community identification by state VR agencies, and intensive, targeted, and universal technical assistance, including information dissemination via a state-of-the-art website and national state VR agency forums and meetings. Project E3 activities will include extensive knowledge development. E3 partners conducted a technical assistance needs assessment survey of 80 state VR agencies. We'll create a literature review of emerging, promising, and evidence-based practices. We'll support active involvement of targeted community experts and representatives, and will facilitate focus groups, structured interviews, and interactions via webcasts and teleconferences. Project E3-TAC will assume the majority of the responsibility in drafting and developing the intensive TA plan. This activity will be done in partnership with the state VR agency. This effort will include surveying state agencies to identify at least 2 underserved groups located in targeted communities and selecting 20 targeted communities for which to develop intensive TA proposals. Proposal development will be conducted in a way that eases the burden on already stressed VR agencies. RSA will then select 12 targeted communities to receive intensive technical assistance. Intensive technical assistance activities will often be provided on-site and will require stable ongoing relationships between Project E3 staff and the TA recipients, including VR agency staff, rehabilitation professionals, service providers, and state and local community stakeholder groups. Intensive TA project results will include changes to policy, programs, practices, or operations that support increased recipient capacity or improved outcomes at one or more system levels. Community advisory boards aid in development or expansion of formal and informal partnerships state VR agencies have with local social service and community development agencies, correctional facilities, community rehabilitation programs, CRPs, school systems, employers, community leaders, and other stakeholders. Community advisory boards exemplify the difference between intensive TA and other forms of TA and will also aid in sustaining the TA efforts over time. Co-ops are partnerships across service systems designed to develop, implement, adjust, support, and evaluate VR processes and strategies. They are engaged in promoting competitive integrated employment for high-leverage groups with national applicability from targeted communities. Project E3 will design and facilitate no fewer than 2 communities of practice with the following areas of focus. One co-op will be designed to specifically support state VR agency and related agency staff and management serving targeted communities. One co-op will be designed to be more general in nature, open to all staff and management serving economically disadvantaged communities nationwide, and to address the employment needs of individuals with disabilities in those communities. Targeted TA services will be provided based on needs common to multiple recipients and not extensively individualized. A relationship will be established between the TA recipient and one or more Project E3 staff. Targeted TA will include one-time, labor-intensive events, such as facilitating strategic planning or hosting regional or national conferences. It can also include events such as facilitating a series of conference calls or webinars on single or multiple topics that are designed around the needs of recipients. Universal TA services will be provided to independent users through their own initiative, resulting in minimal interaction with TA Center staff. Universal TA will include one-time invited or offered conference presentations by TA Center staff and information or products in the form of newsletters, guidebooks, research synthesis, available on TA website, and communication via phone or email. Universal technical assistance activities will include information provided to independent users through their own initiative, use of labor market data and occupational information to increase employment, disability-related consultation and services to employers, how to build relationships with industry leaders, employer associations, prospective employers, secondary and post-secondary educational systems, and CRPs, leveraging individualized wraparound services to meet basic education, remedial learning, and increase literacy support youth transition. Methods to customize employment and training services addressing the needs of both employers and individuals with disabilities. Increasing awareness of cultural and socioeconomic barriers that negatively impact employment. and provision of relevant information regarding the WIOA pre-employment transition services and sub-minimum wage limitations. Project E3 will also establish a state-of-the-art website for information dissemination. Webinars, teleconferences, video conferences, and other virtual methods of information dissemination and technical assistance will be provided through this platform. During years 2 and 4, National State VR Agency forums will be dedicated to discuss progress and lessons learned from targeted communities. In addition, meetings will be held with state VR agencies to review the data collected, best practices developed, and lessons learned through the intensive intervention sites served within the 12 targeted communities. Project E3-TC's executive team members are national experts in the key issues affecting high-leverage groups with national applicability in targeted communities and in the state federal VR system. Their diverse specialties, skills, along with system and community networks, reflect the diversity of the population served and inform project development. Project E3 activities will include providing intensive TA services to state VR agencies within selected targeted communities. Intensive technical assistance will focus on targeted communities in 5 states: Louisiana, Montana, Kentucky, Washington, D.C. within the District of Columbia, and Illinois. Southern University is leading the effort in Louisiana to provide resources and aid in implementation of intensive services. 2 communities in Louisiana will be the focus of these efforts. TC1 in Louisiana will focus on LA area codes 70112 and 70113, Orleans Parish. The high-leverage groups with national applicability in these efforts include African Americans from low socioeconomic status with HIV or AIDS in Orleans Parish, New Orleans, and African Americans from low socioeconomic status with mental health conditions in East Baton Rouge Parish, Baton Rouge, Louisiana. The University of Wisconsin-Madison campus is leading the development of intensive services in Montana. For TC2 in Montana, 2 sites will be impacted: Glacier County and Blackfeet Reservation, and Bighorn County, Montana. There are 4 groups identified as having national applicability along with characteristics at the intersection of low socioeconomic status and disability. Those groups are persons with alcohol and other drug addictions, AODA, persons with diabetes, persons with depression, and persons with traumatic brain injury, TBI. The University of Kentucky is leading the efforts towards implementation of intensive services in Wayne County, Kentucky, with replication of services to be offered in Jackson, Lee, and Breathitt counties. As with each of these Project E3 efforts, populations being served include those at the intersection of economic disadvantage and disability. In Kentucky, populations in rural and remote communities have been identified to serve the needs of 3 groups: transition-age youth with the most significant disabilities, persons with multiple disabilities including substance abuse disorders, and persons with multiple disabilities including mental health diagnosis will be the focus of the intensive services efforts in Kentucky. George Washington University has worked within the DVR agency structure in the District of Columbia to identify needs for intensive services. TC4 will focus on Washington, D.C., Ward 8, with replication in Wards 5 and 7. The 2 groups identified as needing intensive services are African American SSDI recipients with low literacy and limited education, and African Americans with comorbidity. The University of Illinois Urbana-Champaign campus leading efforts in Cook County and Winnebago County, Illinois. The 2 groups identified with the state DVR as most in need of intensive services are adults between the ages of 18 and 65 who were formerly incarcerated and individuals who are aging out of foster care between the ages of 18 and 25. It is important to reiterate that each of these efforts will address needs of people with disabilities who also have low socioeconomic status and meet the RSA definition of high leverage group with national applicability. For more information about Project E3, contact the project director, Dr. Maden Kundu, at area code 225-771-2325 or kundusubr@aol.com. His fax number is 225-771-2390 and mailing address is Dr. Madan, M-A-D-A-N, Kundu, K-U-N-D-U, Project Director, Project E3, Southern University, Baton Rouge, LA 70813. Project E3's website address is http://projecte3.com.